Diggiss from Doctors Hospital, Nassau, Bahamas. And I'm here having a one-on-one conversation with Dr. Richard Rothman from the Cleveland Clinic, Florida. And we're going to have an interesting conversation on COVID-19, the virus, the variants, and the vaccine. We're into mid-September, Richard, 2021. And Doctors Hospital, to put it mildly, is struggling. And it doesn't make us unique. There are quite a number of healthcare facilities that are struggling at this point in time. We're beginning to see a slight decline from a peak, but there's no question that we've been overwhelmed. Our resources have been almost exhausted. We have been down to 1 or 0 ventilators available at any point in time during the past month. In fact, from the end of July until now, the middle of September, this has been described as a punishing course of COVID. And so it's opportune that you and I get a chance to have a chat, which is intended to enlighten more than anything else, just to, even if we can simplify, but to enlighten a target audience of healthcare workers and the public, bringing our perspectives, leaning clearly towards yourself mainly for the perspectives and myself for the simple questions for the most part, but trying to make some sense out of how does one get to decision as a public or as a healthcare worker. So I think right out of the gate, I want to toss it over to yourself. Tell us a little about you and what kind of experience you're having at your facility in Vero Beach.
Dr. Diggiss, thank you. And thank you to your viewers for watching today. And thank you for having us. My name is Richard Rothman. I am the Hospital Medicine Institute Chair for Cleveland Clinic, Florida. I oversee the clinical hospital operations for all of our hospitals in Cleveland Clinic, Florida. And I am the lead physician for COVID operations here in the Cleveland Clinic, Florida. I want to take a minute to reflect on some of your comments, Dr. Diggiss, because they're powerful, right? The idea that it's September 2021 and we're still talking about COVID, hospitals struggling to get oxygen and ventilators, patients dying, and resources being exhausted. And why that's so powerful in 2021 is in 2020, we didn't have the tools to combat this virus, and today we do. I'll share with you some of our experiences here within the Cleveland Clinic, Florida over the past few months, and they're not so dissimilar to yours. In early July 2021, we had 36 patients hospitalized across Cleveland Clinic, Florida, a hospital system with more than 1,000 beds. Within 6 weeks, we had nearly 400. That's a 700% increase in COVID cases within 6 weeks. 40% of our hospital was occupied by patients with COVID. Of those patients, 87% of them were unvaccinated. This surge was unlike any other. It came on rapidly, and it was a punch in the gut to the healthcare system. The reason for these differences from previous surges is this Delta variant, right? And this Delta variant is transmitted at a rate that far surpasses the ancestral variant or the first variant of COVID that all of us experienced. To put that into perspective for our viewers who are familiar with chickenpox and flu, the only virus in the last 100 years that spreads faster than the Delta variant of the coronavirus is measles. How do we prevent measles today? We vaccinate against it. Guess what the second most transmittable virus we have today is? It's the chickenpox. How do we prevent the chickenpox today? We vaccinate against it. I could go on, but the answers are not dissimilar. The only way to mitigate the spread of deadly viruses that spread at a rate far greater than anything we have experienced before is through mitigation strategies, which include vaccination. And so when we stand here today in the Bahamas and in Florida, it should say a lot to all of us that 40% of patients in our hospitals have one diagnosis. There is no time that one diagnosis should take up 40% of our hospital beds. Hospital resources are not inexhaustible. Similar to what you're experiencing in Doctors Hospital, patients at other facilities that are sick, needing care, mothers looking to deliver their babies at the hospitals can't be transferred over to our facilities because our facilities are full. And they're full with patients that may not have needed to be hospitalized. And so when we talk about the experience of COVID here in Florida, it is going to parallel that of the Bahamas.
Yep.
What I recently learned that I think is exciting, Dr. Diggiss, is more than 500,000 doses of the mRNA vaccine were delivered to the Bahamas, and I think we'll get into that a little bit. Now is a time for us to come together. Now is a time for us to prevent the spread of this disease. This is it. This is our opportunity to make a difference.
Yeah, no, that's extremely sobering, Richard, as an introduction, and thank you so much for putting that tone out there. As I listened to you chronicle the journey at your facility specifically and throughout Florida in the Cleveland Clinic Health System, it is even more stark that at Doctors Hospital and by extension in the public service, hospitalizations for COVID consumed north of 90%.
Wow.
Almost an exclusive reason for admission, almost an exclusive attending to the emergency rooms would be COVID, to the extent that non-COVID issues have been marginalized. And this, as you can appreciate, is going to be a price we pay down the road for delayed and deferred care. And that's a consequence that we certainly will bring up at another time. But it's extremely sobering that this virus has come on with this intensity at this time, which raises a question, Richard, about, so what's with the variant formation behavior? Where does this come from?
It's a great question. So what leads to these variants, and what is a variant? Well, variants occur two ways. Number one is through geographic separation, meaning moving from the Bahamas to Florida to Europe to Asia. And another is through transmission. Each time the virus passes through one of us, there's a potential for variant formation or mutation. right? Because a virus is a piece of RNA or a piece of genetic material.
Yeah.
And each time it passes through us, there's a possibility that it could change. But I think I know what you're thinking when you hear that. Let's stop the transmission, right?
Absolutely. And maybe you could echo the messaging that you can get COVID more than once. There is no reason for you to be fortified by the fact that, well, I've had COVID, and we'll talk later on about this, even while I'm vaccinated, therefore, I don't have to pay attention to getting COVID again. You want to speak to that? Because I think this is an important part of that mitigation plus vaccinate message.
Sure. And the recent studies, some of which are coming out of our Cleveland Clinic, Ohio campus, have shown that there is some durable immunity following being infected with COVID, meaning that you can have the infection, and for the first, 3 to 6 months, you may be protected from a recurrent infection. What we know, though, is compared to those that are vaccinated, unvaccinated individuals who have acquired COVID and have not gotten subsequently vaccinated are much more likely to get infected and to have severe disease than those who have been vaccinated.
Interesting. And that's important. And we will echo that reminder throughout this conversation. But let me take it to a natural history question. As we both come off this particular peak or wave or surge, what should we anticipate if a significant number of our population gets vaccinated? And as we say in the Bahamas, Bahamians actually behave themselves and comply with the mitigation essentials like masking indoors and maintaining the physical distancing, etc. If that indeed is the case, because COVID and COVID care exhaustion and fatigue is at an all-time high. So what does that future or natural history look like? What's likely to be the next few months or years of COVID looking like?
So it's a great question, and it dovetails into the question around, does vaccination prevent disease or does it mitigate the severity of the disease, right? And I think that will tell the story of what happens next. And number one, with 500,000 doses of Pfizer in the Bahamas, and countries around the globe trying to get their hands on the mRNA vaccine, this is a great opportunity to get everybody vaccinated, number one. Number two, vaccine prevents severe illness. And while it may be difficult for us to completely eradicate the coronavirus that causes COVID, we can certainly mitigate it, right? And so by all of us getting vaccinated, this turns into a bad cold.
Yeah.
The transmission goes down. And suddenly we're not talking about COVID anymore. We get our vaccine and we can get back to our normal lives.
Yeah. No, I like that because
and I think that's what do you think, Dr. Diggiss? I think that's what it looks like.
Yeah, no, I completely agree because, in as much as, our private health systems enjoy the business, this is not the business that we want. This is an extremely avoidable situation, and we're beginning to see needless deaths. And so, yeah, I absolutely believe that if it's a matter of living with COVID and admissions to emergency rooms in a hospital see a diagnosis of the flu or respiratory illness, undefined or non-specified, etc. And then COVID becomes one of the determinants after the fact. And that's only 10, maybe 15% seasonally of what we see. Yeah, I completely agree with that. So, well, Richard, let me change the topic a little bit because I know that we're going to keep pounding away at this is avoidable. This is avoidable. So let's help some decision making. Let me talk about the vaccines now. So we, in our experience, were introduced to AstraZeneca, 2 doses, and, appreciating that this is an attenuated adenovirus vaccine, a little different from Pfizer with the an mRNA vaccine. And you could probably just speak a little simply to, why is that important when we talk about repeat vaccines or boosters? But the question is going to come. You could see it all over Facebook and in Bahamian conversations. Oh, you had AstraZeneca. Well, I had Pfizer. Almost like a superiority, a superior vaccine. Of course, the theme has to be at any point in time, the available vaccine, get that. But how do you, or would you approach a conversation that was pitting AstraZeneca, Johnson & Johnson, Moderna, and Pfizer, pound for pound? And the question to you was, so I got these 4 choices, which one should I get?
So that's great. That's a tough question to answer, but I'm going to answer it simply. And I think you did. Number one, you get what's available, because all of the vaccines have been shown effective at preventing severe illness from COVID, right? Some of them have been more effective than others, but all of them have an efficacy that's high enough to be approved by the governing bodies across the globe, right? AstraZeneca, Johnson & Johnson, Pfizer BioNTech, and Moderna are all great vaccines. They work a little different. When you look at efficacy, and this is important for your viewers, right, Dr. Diggiss, what do we mean when we say efficacy? The ability of the vaccine to prevent you from getting very sick. We fully recognize that vaccines are not going to prevent everybody from getting the coronavirus. Vaccines will turn the coronavirus into something that's manageable, right? Into a cold, right, a runny nose. And so if you've gotten AstraZeneca and you've gotten 2 doses, good for you, because that means you stepped up and you got it first. And my guess is that you're not seeing many patients with AstraZeneca come into your hospital in the Bahamas.
Right, not at all. Well, very, very
right?
Very
few.
Yes. So breakthrough infection.
That's a good point. It's low. Breakthrough infections are low, and none of these vaccines are 100% effective, right? And so the mRNA vaccines, which are the Pfizer and Moderna vaccines, which were the only vaccines available in the United States, if you recall, up until the Johnson & Johnson came out recently. We do not have access to the AstraZeneca vaccine in the United States. The vaccine efficacies against the Delta variant at preventing severe disease is well over 90%. When you look at AstraZeneca, the number is right around 80%. At preventing severe disease and hospitalization. And I know in Florida, and I think similar to what you're seeing, Dr. Diggiss, 87% of the patients that are hospitalized with COVID didn't receive a shot.
Yeah.
It didn't matter if they had Johnson & Johnson or Moderna, they received nothing.
Yeah. That's hugely important, Richard, because it's the partially vaccinated or the unvaccinated that formed the predominant number of patients admitted to hospital with severe COVID, escalating to ventilation and death. And, the theme of preventing hospitalization, minimizing the severity of the illness, preventing the need to go onto a ventilator, preventing death, that theme is the one that really should prevail. But despite that, I do want you to just take a moment to reassure our public that even though those themes that we just mentioned, regardless of the time it took to make the vaccine and whether it's a real vaccine or not, that should be the echo. But having said that, why don't you spend some time for those who are saying, I don't know, I'm hesitant, I'm skeptical. This took maybe a year and I'm not sure. And then you're talking about an emergency use authorization. Is this like conditional? And does it take the administrator off the hook should something happen to me? You wanna just chat a little about that?
Sure. It's a great question. So with the Pfizer arriving in the Bahamas, what I can tell you unequivocally is nobody in Florida that I have seen has grown a third eyeball from Pfizer. They're all doing pretty well, and they're not showing up at our hospitals. Number one. Number two, the time it takes for drugs to get to patients is determined by not just the study period, which usually is a couple of years, 1 year, maybe 2 years, but by how long it takes for all that paperwork to get done so that the drug can be authorized. And what we were able to do with these medications, these vaccines, was we were able to conduct the study, right? The Pfizer vaccine, which arrived in the Bahamas, the study includes over 40,000 people. And today, more than 150 million, right? We're 2 years ago, or a little over a year and a half ago now. So 150 million people have gotten a shot. I've been in medicine now for 12 years. I can't remember any study with 150 million people in it. And so, yes, they were able to get this to market quickly, but if you recall, the FDA committed to getting through the paperwork quickly. And so because of that, we were able to get this to market. We did not compromise on the study design or the safety reviews. The rigors were still there, but we cut out a lot of the bureaucratic process to get the vaccine to market.
Yeah, and like you say, 150 million doses and counting. I mean, yeah,
a lot of.
Completely. So let's talk about making a decision to get vaccinated. So we have Pfizer, it's available, but I just got COVID. I mean, I think I have the symptoms. I'm going to get tested. I may proceed to getting tested. It's confirmed. So when do I vaccinate then? I mean, when do I vaccinate?
So we know that number one, if you have gotten COVID and you're interested in getting the vaccine, and you're 10 days out from your COVID infection and you're feeling okay, it's okay to go ahead and get the vaccine, number one. So you can get the vaccine after you've had COVID, and you should get the vaccine. In general, you're protected for about 90 days after you've had COVID. And so we typically recommend within 3 months of having COVID, going out and getting vaccinated. So irrespective of whether or not you've had COVID, we highly recommend getting vaccinated.
Yeah, Richard, what's the utility, your opinion on getting antibody levels done, antibody testing in that window? What's the utility?
So the way I'd like to explain that is we don't know enough about which antibodies are protective. And so the antibodies that we're testing for may signify that you've had the illness or that you've had the vaccine, but they don't tell you if you're protected. And so we don't have enough information on the type of antibodies that we would need to test for to tell you if you're protected from COVID. And it's a common question. I get my doctors call me up with this question. I don't need to get the vaccine. I got the antibody test and I have antibodies.
Right.
Yeah, and then 2 weeks later they have COVID, so the antibody tests today are not recommended by the CDC to determine whether or not individuals should be vaccinated, and we are not recommending them at this time.
Okay, so let's walk a little into a gray zone of the third shot or the booster shot. So what does that look like? This is the middle of September 2021. You and I are fully vaccinated. I got AstraZeneca, you have Pfizer. So when should we be thinking next shot or booster shot?
Great question. There's a body of evidence that is building around the third shot or the booster shot, right? And so for the audience out there, the third shot is different than the booster shot, or the indication is different, right? So the type of shot you're getting is the same, but the indication is different. Currently, the FDA and the CDC are recommending third shots for individuals who are immunosuppressed. And the third shot means that after your first 2 shots, you may not have had an adequate immune response. And so the third shot helps you build that immunity. That's in contrast to a booster shot. The booster shot is for those individuals that have had immunity, and they may just need a boost to that immunity. And there is still a growing body of evidence around the booster shots, and we're waiting on final recommendations from the FDA and the CDC about the booster shot. But we are recommending those individuals who are immunosuppressed, meaning they're being treated for cancer, they're on steroids, for those individuals to consider a third dose.
Yeah. So stay tuned. There's no need to rush to getting
That's right.
topped up, if you like. Okay.
That's right.
So I'm not going to spend a long time in the space of pregnancy, but a broad question. Pregnancy, the state itself, first, second, third trimester, is there a concern about getting vaccinated throughout pregnancy?
You know, there is a concern about getting COVID throughout pregnancy. And with the pandemic ongoing, we know that pregnant women are at very high risk for severe disease if infected with COVID.
We've seen some deaths.
Studies.
We've seen some
yes.
deaths. Yeah.
Have you?
Yeah.
And so, and that's in keeping with some of the studies that are out there suggesting that pregnant women are at very high risk for severe illness from COVID. And so recent studies have come out of the New England Journal of Medicine looking at the efficacy and the safety of the vaccine, the mRNA vaccines, in women who are pregnant. The current data suggests the vaccine is both safe and effective. There are, of course, ongoing trials to assess that efficacy. The American College of Obstetrics and Gynecology has come out with a powerful statement, and they strongly recommend all pregnant women consider vaccination because the risk to you and your baby is greater if you get COVID than if you were to get the vaccine.
Yeah, that's very sobering. And I trust that assists individuals in that conversation with their obstetricians. And again,
that's right.
There is no concern when the individual is thinking about pregnancy, and no concern in the first trimester. This is where a lot of that argument starts to rumble. No concern. When you weigh the pros and cons, as you put it, the benefits far outweigh the negatives and the deleterious effects of COVID. That's great. That's really great. So let me talk about healthcare workers. Let's talk about ourselves for a while, because our compliance rate with physicians right now, we polled the 100 top utilizers, physician utilizers, and we're still getting, I want to say, about 50 to 60% who would have submitted documentation of being fully vaccinated. We looked at the other healthcare workers, especially the nurses and the other frontline supportive workers, and it's increasing, but it's nowhere near where it needs to be. It's still down to about 25, 30%. So how do we either pivot or change strategy on this message? It almost undermines our message to the public. You can't convince your colleagues or your healthcare providers to vaccinate. What strategies would the Cleveland Clinic organization have used other than forced vaccination to keep your job? But what strategies do you think would be the most effective ones so that our message is not undermined by, whoa, Dr. Rothman, your folks are not vaccinated?
So with that, so just some background. In the United States, recent data suggests that more than 90% of physicians are now vaccinated. Not 100, but more than 90%. Throughout the Cleveland Clinic, our workforce of more than 60,000 people, about 70% of all of our caregivers are vaccinated. However, we looked not dissimilar to Doctors Hospital a few months back, right? And so I think it's important for all of us to recognize that this is a conversation about public health and safety, not about constitutional rights and mandates, right? And so I am not here, Dr. Diggiss is not here to have a conversation about mandates and individual rights. What I'm here to say is that we understand that there's some distrust around medications. We understand that this is scary what's going on. And what I would hope all the viewers would hear is the same things that we would recommend to them, we would recommend to our family and our friends. And our recommendations are aligned to keep everyone safe. And that's the direction we're going. It's not to talk about mandates. We want to see you safe. And we know that the vaccines are the best way to do that. And these are some of the safest vaccines that we've ever had.
Yeah, collective responsibility, the public health, and absolutely just reducing the burden of COVID care and the crisis of COVID care in both of our institutions and facilities and health systems. I think that's where we do want to keep the focus going. We'll continue to educate and enlighten and encourage. Require or mandate is perhaps in the future, as you know, your president has decided to take a stand for a particular group of companies, but you can see it coming where the option is then off the table. And perhaps before we get there, we're going to continue to enlighten and maybe move that conversation, as you've indicated, into that space of the public health, the collective good, and the protection of the resources, which is so limited. So with that, I want to move then into the relationship between the Pfizer vaccines, which we have 500,000 and reducing, fortunately, and the Delta variant. And maybe this is opportune for you to enlighten our listeners that we have a winning formula here: a raging Delta variant and the Pfizer vaccine. What needs to happen?
Yeah. Well, okay. Well, number one, the shots need to go into arms, and in order for vaccines to work, there is one thing that has to happen, and that's individuals need to get them, right? And so as we look at the number one, 500,000 Pfizer vaccines, that's a big win for the Bahamas, procuring that at a time where many countries are really trying their hardest to get that. And the reason that the Pfizer vaccine has become so popular is because of its efficacy at preventing severe illness and death from COVID, Delta variant, right? And so the Pfizer vaccine in studies in Europe, Canada, and Israel has been shown to be more than 90% effective at preventing individuals from getting hospitalized or dying from COVID if they have been vaccinated, right? And so, in other words, am I saying that if you get the vaccine, you probably won't die, we probably won't see you in the hospital? Yes, that's what we're saying.
Yeah.
Is the vaccine safe amongst 150 million people? It is safe. And again, I can't say this enough. It's an opportunity for us to turn this pandemic into something that is manageable and allows us to go back to live our daily lives. this Delta variant is scary. And without vaccination, I don't see this ending anytime soon.
Yeah, Delta variant is killing. And it's really a punch to the gut of the healthcare system, utilizing resources that we will no longer have for non-COVID issues. And I know I mentioned earlier, this deferred and delayed care, you know, we're going to see not just a wave of COVID, we're going to see a wave of increased morbidity and mortality from non-communicable diseases, etc. The things that we would have otherwise been treating. And so I think I want to just echo, the vaccines are here, the shots, they got to get into arms, and the Delta variant is raging. It is taking a significant toll. So let's just focus and get the vaccination done and get us to the point where we're truly living and working with COVID as we live and work with the flu. So parting comments, as you reflect on this whole experience, the last year and a half of this virus, its changes, its variants, and then this, what I think we could say is either surprising or disturbing experience with vaccination. And maybe we should have anticipated this, because history probably would have taught us that this is not the first time that vaccination skepticism and hesitancy existed. But as you look back on this, Richard, are there any lessons you think that we can learn in this experience as we prepare ourselves for what's coming down the pike as far as, you know, different or additional virus infections? What are your thoughts?
Yes. I'm going to take a sanguine approach here. I know that this is somewhat of a somber conversation at times. But one thing is that history has proven is that togetherness will overcome divisiveness. And together, we can really put an end to this pandemic. And the vaccine is the way to do that. And while there is some skepticism around the vaccine, there is some distrust, understandably, around the vaccine. This is one of those times where the healthcare industry and the scientists came together and they got it right. And government lifted their bureaucratic weights so that we can get this to patients. And if there's anything that the viewers walk away with, I want them to consider that togetherness really does overcome this divisiveness that we're seeing around the vaccine. This is not about mandates. This is an opportunity to put an end to a very deadly disease. And we want to be there to help other patients, because by not getting vaccinated today, it's not just affecting you, and we want to protect you. It's protecting your loved ones that can't get into our hospitals because they're full.
Yeah.
And so, again, that togetherness is so important right now. And I would like to emphasize that. And geez, you guys are pretty lucky to have that 500,000 doses at a time where everybody is vying for them.
Yeah. Well, that very well said, Richard. Thank you, so much for participating in what has been, to me, enlightening, educational for the public. I think extremely beneficial for the Bahamas just to hear a message coming from different messengers, essentially agreeing and encouraging the public to just focus on what is truly important, the togetherness, the collective, the public interest and the public good, protecting our facilities so that we actually can treat issues other than COVID, and then enabling you who are listening just to be around a little longer so that we can enjoy all the benefits that come with life without having to necessarily end up in a Cleveland clinic or a doctor's hospital because of something entirely avoidable. So I do want to thank you so much for your energy and your enthusiasm in participating in this one-on-one with Richard Rothman from the Cleveland Clinic, Florida, and myself, Dr. Charles Diggiss, Doctors Hospital, Nassau, Bahamas, chatting about the virus, the variants, and vaccination. I hope you truly enjoyed and benefited from this forum. Thank you so much, and goodbye.